schools aren't going to participate in it. That's the question. They will. Can't wait till this is all over.
Good afternoon, everyone, and welcome to our daily COVID-19 update briefing. Dr. Ezike and I are joined today by Dr. Emily Landon, the Executive Medical Director of Infection Prevention and Control at University of Chicago Medicine. Dr. Landon has joined me today to recenter our conversation on what matters most, the health of our people and the trends that are moving that health in a precarious direction. As more and more of our regions see upward movement that requires additional intervention, I've made it a point to illustrate exactly what kind of concerning scale we're seeing compared to previous months of this pandemic. Today, I want to do the same on a statewide level, because statewide, we have a real problem on our hands and people's lives hang in the balance. Let me start with leading indicators. We are seeing substantially more confirmed cases right now than we ever saw in the spring. Since the beginning of October alone, new cases are up more than 150%. The highest 7-day average number of cases we reached in one day in the spring was 2,565 in early May. That came down to about 590 in mid-June. Today, we are at a new high, a 7-day average of 5,043 new cases per day, closing in on twice what we saw in May. Today alone, we're reporting 6,363 cases. We're able to test far more people than we did in the spring, which is very helpful for detecting new cases. But let me be clear, our cases are rising at a much faster clip than our testing. We're now averaging more than 73,000 COVID-19 tests per day. Today, for example, we are reporting more than 83,000 tests. We're the best testing state in the Midwest, and it's not even close. In Cook County alone, we produce more test results per day than 37 individual states do, and more than half of our country. Even as our testing has grown, between late June and late July, our case positivity stayed steady between 2.5 and 3%. From late July to a few weeks ago, it stayed more or less below 4.5%. Today, it's up to 6.9%. And our current test positivity average, which we use for mitigation decisions, is 8.2%. The growth rates that we're seeing in positivity rates, hospitalizations, and deaths are telling us that we are again experiencing a meaningful and sustained increase in transmission of this virus. Our positivity rates alone are cause for action, but our challenges don't end there. Broadly speaking, hospitalizations are a lagging indicator of rising community spread. It could take days or even a week after a positive COVID-19 test for a person to require hospitalization, while others might receive a confirmation of their positive test when already in the emergency room, possibly struggling to breathe. Since the beginning of October alone, statewide, the number of Illinoisans in the hospital with COVID-19 has grown 73%. Let me repeat that. Since the beginning of October alone, statewide, the number of Illinoisans in the hospital with COVID-19 has grown 73%. We came into this month with an average of 1,570 patients in the hospital fighting COVID-19. Today, hardly 4 weeks later, that average is up to 2,700 and growing. There are some individuals who think that we've solved the COVID-19 crisis by developing some treatments for those who have already entered the hospital. But when you look at the actual lived experiences of people who require hospitalization, that statement just doesn't really pan out. in the same time that hospitalizations have grown by 73% across our state, the number of patients requiring admittance into the intensive care unit is up 61%. Lower, yes, but not a gap that anyone should start betting their life on. On October 1st, we were averaging 360 people in the ICU, COVID-19 patients in the ICU statewide. Today, there are over 580 in the ICU. Let's not forget ventilators, which, as any of the doctors standing behind me can tell you, is not a place that anyone ever wants to be. Too many patients who end up on a ventilator do not come back. They just don't. And here in Illinois, similar to ICU patients, the number of patients on a ventilator is soaring, up 61% since October 1st. Tragically, we aren't going to be able to save everyone from this pandemic, but we are doing our best to save as many people as we can by lowering the rate of spread in the community, which will not only allow more kids to go to school and more businesses to operate safely, but also will improve our ability to keep Illinoisans healthy. Those should be the goals that we can all get behind. Deaths are a lagging indicator, and we can see in these numbers the consequences of rising case rates and hospitalizations and ICUs and ventilators across our state from weeks ago. And unfortunately, I'm afraid we can expect worse to come. Deaths from COVID-19 are up 82% since the beginning of October, when we were averaging 23 lives lost each day. Now at 41 lives lost each day. That means that every day we are averaging another 41 mothers and fathers, children, grandparents no longer with us, adding to the total of Illinoisans lost, now approaching 10,000, and the number of Americans lost, now more than 230,000. I know that the vast majority of people in this state are all in on the fight against this virus, just as they fight against the other battles, or fight the other battles, against things that take too many lives, like car accidents and cancer, by wearing seatbelts, by not smoking on planes, by getting a flu shot, by smearing sunscreen across your children's faces in the summer heat, by running the race for the cure, by learning and adapting our lives so that we can all live. I know that the vast majority of people in this state want to keep themselves safe, keep their families safe, keep their children safe, their parents, their neighbors, their friends. Unfortunately, as these trends indicate, things are moving in a bad direction all across our state. And as of this morning, Region 3, which encompasses Quincy, Springfield, and much of west central Illinois, has now sustained an average positivity rate of 8% or higher for 3 days in a row, today hitting 8.8%, meaning that starting Sunday, they will join the majority of the state in operating under resurgence mitigations. That's up from 4.6% in mid-September, the summer peak of 6.2% in mid-August, and the all-time low of 0.9% in mid-June. And the region's COVID-related hospital admissions today have tripled since early September, something that has got to change. And these mitigations aim to cut down on those high-risk activities until we bring down the positivity rate in an area once again. In the meantime, we're upping our testing support with a new mobile site, setting up at the Sangamon County Health Department Saturday through Tuesday, with more to come in that region. As for our remaining regions that are free of resurgence mitigation measures, Region 6 has now seen 2 days in a row of a positivity rate reaching 8%, meaning that a third day, tomorrow possibly, would equal new mitigations in that region. Region 2, which stretches from Kendall County to Rock Island County and includes Peoria, remains the sole region of the state with a positivity average below 8%. But at 7.9% and growing, that might not be the case for very long. We're ensuring testing availability there too, with Region 6 seeing mobile testing in Ford County today, in Richland County tomorrow, Effingham on Sunday, and in Macon at Decatur Civic Center today through Sunday. And next week, Region 6 will have a testing site from Monday the 2nd through Sunday the 8th at Danville Area Community College. And in Region 2, Peoria has mobile testing today and tomorrow, and Knox County and Rock Island counties will have sites on Saturday and Sunday. Find the nearest site near you. It's easy. Just go online to dph.illinois.gov/testing. Before I turn the podium over, let me just say this. All of the data that I walked through today is present every day on our DPH website. It's updated every single day, both statewide and by region, so that people across the state can use it to make decisions for themselves and their families about what more they can do to keep each other safe. And not just on the individual level. Across the state, local health departments, hospital systems, and community leaders can and should engage with this data, analyzing it and asking questions and using it to protect their communities. Because let's be clear, well-meaning and reasonable people can have fair disagreements about how and where to draw lines and connect dots, but when every single metric in every single corner of our state is trending poorly, we have to take meaningful action to keep our people safe. And with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Thank you, Governor. Thank you for laying that out so clearly, and thank you for your tireless efforts. Let me get straight to the numbers. I think many of them the Governor has shared. In the past 24 hours, more than 83,000 tests were reported for a total of nearly 7.5 million total tests. Today, again, we are reporting 6,363 new cases of COVID-19 for a total of 395,458 cases. Since yesterday, we have been notified of an additional 56 lives lost, again, for a total for Illinois of 9,675. In the hospitals, overnight, we had 3,030 individuals. Of those, 643 patients were in the ICU and 269 were on ventilators. Our entire mission during this pandemic is to reduce the number of cases, to reduce the number of hospitalizations, and reduce the deaths. One way to do that is through contact tracing. Since the first case of COVID-19 was reported in Illinois, contact tracing has been conducted. That's how we knew that our first case had traveled, had returned from Wuhan. That's how we knew that the second case was in fact the spouse of the first. Public health officials across the state, across the country, across the world conduct contact tracing on a daily basis. It's what we do for measles, for tuberculosis, many other diseases, and of course now COVID-19. It is something that we've always done and we continue to do on a daily basis. We collect this information so that we can help prevent additional cases. The quicker we're able to identify individuals who have been exposed, the quicker we can have them self-quarantine and thereby interrupt disease transmission, hopefully preventing additional people from being exposed to the virus. Because of the sheer volume of cases, again, over 6,300 cases were identified just over the last 24 hours. Almost 400,000 cases in total. Local health departments across the state are hiring and training more and more contact tracers. But again, as these numbers surge, public health is being stretched very thin, even as we bring the new contact tracers on board. When this happens, the contact tracer may not have the opportunity to follow up with every case for further clarification about where they visited in the weeks prior to being diagnosed and who exactly they were with after. We are doing our best to collect as much information as possible so that we can have the most complete picture of where COVID-19 is spreading. But of course, we can't do that without your participation. We're hearing from the local health departments and the contact tracers every day that some people won't answer the phone. And if they do answer the phone, they don't give the answers to the questions. There's also a number that's provided to call back, and often no call back. Please, if a contact tracer calls you, answer the phone. Please give as much information as you can. Public health officials can only track information that we're actually given. We can only share information that we have. So please make sure to provide as much information as you can so that we can absolutely slow down the spread of this virus. Contact tracers are required to keep private health information confidential. We will not give your name to anyone. They will simply indicate to the individual that may have been exposed that they have been in close contact with someone who tested positive and that they would need to quarantine. I imagine that once someone identifies themselves as a case, they probably will do the same thing and start notifying those that they're aware of. This information and letting the contact tracers know and people reaching out to people they may have been in contact with will slow the spread. So please, again, wear your mask, wash your hands, and watch your distance. And of course, also get your flu shot. I have already gotten reports of individuals with both flu and COVID at the same time. We don't want to battle this twin-demic at the same time with the same number of hospital beds. And please, if you get that call from the contact tracers, please answer the phone and please share the required information. Thank you. Now the remarks in Spanish. Buenos días. Voy a comenzar con los números. Hoy informamos 6,363 casos nuevos de COVID-19 en Illinois para un total de más de 395,458 casos confirmados. Desde ayer hemos recibido las noticias de 55 muertes adicionales para un total de más de 9,675 muertes. 3,030 personas en Illinois pasaron la noche en el hospital. De ellos, 643 pacientes estaban en la unidad de cuidados intensivos y 269 pacientes estaban en ventiladores. Más de 83,000 pruebas de COVID-19 fueron hechas por un total de más de 7.5 millones. Nuestra misión durante esta pandemia es reducir el número de casos nuevos, el número de hospitalizaciones y muertes. Una forma de hacerlo es el rastreo de contactos. Desde que se informó el primer caso de COVID-19 en Illinois, el rastreo de contactos comenzó rápidamente. Así es como supimos que la persona acababa de viajar desde Wuhan, China, y que el segundo caso en Illinois era su esposo. Las oficiales de salud pública en el estado, el país y todo el mundo realizan el rastreo de contactos diariamente. Lo hacemos por sarampión, tuberculosis, otras enfermedades y ahora COVID-19. Esta información ayuda a prevenir casos y brotes adicionales. Lo más rápido que identificamos los contactos, lo más rápido podremos evitar la propagación de este virus. Con casi 400,000 casos confirmados de COVID-19 en Illinois, departamentos de salud locales en todo el estado están contratando y capacitando a más rastreadores de contactos. Estamos haciendo nuestro mejor esfuerzo para poder tener una imagen completa de dónde se está propagando COVID-19, pero necesitamos su ayuda. Escuchamos que cuando los rastreadores de contactos llaman, algunas personas no responden al teléfono y si contestan su teléfono, no responden las preguntas. Por favor, si un rastreador de contactos conteste el teléfono y comparte toda la información que puedas. La información que das a los rastreadores de contactos es confidencial. Simplemente ellos informan a otras personas que han estado en contacto con alguien que dio positivo y que deben ponerse en cuarentena. Esta información realmente puede bajar la propagación. Así que, por favor, use su máscara, lávese las manos, mantenga su distancia, vacúnese contra la influenza. Y si recibe una llamada, conteste el teléfono y responda las preguntas. Esos pasos simples salvarán vidas. Muchísimas gracias para su apoyo. And with that, I'm happy to turn the podium over to Dr. Emily Landon.
And thank you, Governor, for inviting me to be here today. But this isn't a happy occasion for me to be speaking. Public health officials, epidemiologists, and doctors like myself predicted this fall would bring more cases, more hospitalizations, and more deaths. We hoped that knowing this would help us take steps to avoid it. And many of us did those things. We dutifully wear our masks, even though we don't really think we could be contagious. We keep distance from friends and neighbors. We wash our hands religiously. And now, as the weather gets colder and the cases still rise, we aren't sure what more we can do. You see, we are where we are today for a lot of reasons, but I'm really worried about the misinformation and fatigue slipping into and covering up our best intentions. I hear people say, sometimes people wear a mask and still get COVID, so why bother? Or sometimes people say that people like me are making a mountain out of a molehill and we should just let everybody get sick and get over it. I know many of you are hearing those same arguments from your friends on social media and even from the news. Sometimes people make these statements, dress them up with some facts or graphs that look almost as convincing as the ones you saw today. They sometimes take experts' comments out of context and make you wonder what we really think. They make you question every inconsistency, every change in guidance. So today, I want to set some facts straight. First of all, inconsistent recommendations are not evidence of a conspiracy, nor are inconsistent data. They're evidence of a changing knowledge in epidemiology. In different situations, different metrics mean different things. For example, when testing rates are low or changing rapidly, the test positivity rate may not mean quite the same thing as when testing rates are stable or when the testing rates aren't increasing as much as the cases. Everyone is trying to use the best information available to make the best possible decisions. There are and will be disagreements about the details. There's no one measure or metric, but rather an understanding of the needs and the pain in the community, both from the virus as well as the consequences. There are new data coming out every day. Science is learning. We change our guidance because we learn something new. Changing advice should make you feel good that we're making progress. Disagreement is a normal part of every process, and there's no one right way to handle a new pandemic. But we're all in the same boat, and we should try and row in the same direction as much as possible if we want to get somewhere. Some people are still skeptical of masks because people like me didn't know very much in March about how important they would be for curbing transmission in the community. Every single study now shows that masks reduce risk. Common sense says that masks reduce risk. Healthcare workers would all get COVID when they were caring for patients if masks didn't prevent infection. And studies of healthcare worker antibodies show that they have had COVID only slightly more than the regular population, despite having very close contact with patients that have COVID. Still, no mask is perfect. But there's growing evidence that if you catch COVID while wearing a mask, you may not get as sick. In fact, a lot of us think that this may be contributing to the lower mortality rate compared with earlier in the pandemic. Did you know there was a study done in Kansas that showed that the areas with mask mandates had lower rates of COVID and lower mortality rates than the places that didn't have a mask mandate? This gives us evidence that masks prevent COVID, but it also tells us that they may reduce the severity of illness and that the mandate is important. Because in counties where there wasn't a mandate, people could wear a mask if they wanted to, and they were even encouraged to do so, but not But when everyone wears a mask, it's better for all of us. So no matter what you hear, masks are important and masks are safe. Construction workers, healthcare workers, artists, all kinds of people have been wearing masks for ages without complications. So stop your fussing and put your mask on, especially now that the weather is getting colder. Which brings me to another point. Warmer air is more humid. It has more moisture in it. You know this. That humidity keeps those droplets that are coming out of our mouth and our nose juicy. And when they're wetter, they weigh more and they fall to the ground closer. But when air cools down, it doesn't hold as much moisture. It's drier, and our HVAC systems are not awesome at putting moisture back into the air, even though they're pretty good at heating it. This you know because you have to buy more lotion. You complain about your dry skin all winter long. You may even buy a little humidifier that you put in the corner and realize it doesn't actually solve the whole problem because it's a bigger problem than you can solve with a little humidifier. That drier air means that your droplets are drier and smaller too, and they can linger in the air. They're lighter, they stay longer, and they travel further. That's that airborne transmission that you keep hearing about, and it's true. Fall and winter weather literally make COVID more transmissible. On top of that, the cold weather makes us spend time inside, in our energy-efficient homes that keep the heat inside and the COVID. There have been numerous reports of super spreader events related to these kinds of situations, and they can be described with the 3 C's. It's unmasked contact with people in a closed space that's crowded, because the more people you have, the more likely one of them has COVID. Many modelers have shown that indoor ventilation in most buildings is not sufficient to prevent the transmission of COVID when people aren't wearing masks. So it seems that limiting indoor gatherings where people don't wear masks is a key part of preventing COVID transmission, and it is. You see, bars and restaurants are one of the few places where people congregate and they can't really wear a mask and eat and drink. Unfortunately, their employees and the restaurants and the businesses are the casualties here, but there's no way around it. It's not just models. Early on, data from Guangzhou showed that recirculated air from an HVAC spread COVID from one family to multiple other families right in the flow of air. 1/4 of cases in Louisiana in August were related to bars and restaurants, and that's when it was warm out. Over 100 cases were linked to one bar in Michigan in a week. And over the summer in Minnesota, 29 bars and restaurants started clusters that spread throughout the community. Shutting down bars and restaurants and putting in mask mandates changed the trajectory of the pandemic in Arizona, Texas, Florida, San Diego, Washington, D.C., Illinois. I could go on. This isn't the fault of any particular restaurant. In fact, the proprietors of these places do everything they can to prevent this from happening. But the reality is that a restaurant can be perfectly safe from 6 to 8 p.m. and become a super spreader event from 8 to 10. It all depends on whether or not someone with COVID walks in the door. And you have to remember that people with COVID are contagious before they even feel sick. Some will never even feel sick, spreading COVID to their close contacts while honestly believing that they're fine. Testing enough to identify all of the asymptomatic cases is still out of reach, even in this state with some of the best testing in the country. And all the contact tracing in the world won't tell you if you've been exposed to the source person if they were never tested. As much as we don't want to admit it, we can't possibly know when we're a risk to other people. The likelihood of anyone, including me, having COVID goes up every time the case count goes up in a community. And we're heading the wrong direction in every metric. Today is higher risk than yesterday, and unfortunately, tomorrow will probably be higher risk than today. And these facts about indoors without masks are not just true of bars and restaurants. Unfortunately, it's true for any contact we have, including small gatherings in our own homes. As our cases go up, our bubble needs to get smaller. It's the only way to stop the spread. COVID thrives on this unmasked contact indoors, and so that's what we've got to stop. We flattened the curve in March because everyone heeded the warnings and kept close contacts to a low number, just your household. Masked encounters with a barista, going to see your doctor, going to the library aren't going to spread COVID, but eating with your coworkers in the cramped break room will. And that in-person book club with wine and appetizers, when you're going to try and be 6 feet apart, will be a lot safer over Zoom. Unfortunately, a Halloween party this weekend could become a super spreader event. And Thanksgiving could be a prologue to a tragedy for your family. We've already had more than enough tragedies already. I know you miss your family and your friends. And some days you probably don't even care if you get COVID. But you do care. We all care. So it's time to start planning your risk the same way you planned your vote. You did plan your vote, right? So go to these places. The IDPH website has all of the information that you saw here today that the governor showed you. It also has a lot of tools that you can use to help find out what's risky and what's not risky. You can also use the Chicago Department of Public Health website. And there's a great free online tool from Brown University called mycovidrisk.app. I strongly recommend it. It uses epi data from your local zip code to help you assess the risk of going to the grocery store or getting together with friends, and it helps you find ways to lower your risk so you are empowered to make your own decisions. Lastly, I just want to say a little bit to all of you out there who don't believe a word I say. You may never understand why the rest of us are still worried about COVID, why we still wear our masks and wash our hands, why we'll skip the Halloween parties and make alternate plans for Thanksgiving, why we eat alone in the break room or scarf down a sandwich outside. It's because we have the grit and the compassion to make sacrifices for the good of our community, for people we don't even know. We pay taxes and stop at stop signs just like you do, but we know why we do it. And we don't mind. It may be hard, but we'll keep doing it because we know real freedom isn't about masks. And you, who don't believe me, are welcome to join us anytime. Governor, I think you have some questions to answer.
We'll take a couple from the room and then we'll go online. 6,000, that's an astonishing number of new COVID cases.
It is.
Can you tell us if they're coming from nursing homes or college students? And what's the severity? Are most of these people asymptomatic, or is it too hard to tell at this point?
I think because the data literally comes out, it comes to us during the course of the morning, and we produce it for you. What we can only provide in that data is the ages and the locations today of the 6,000 people that we're talking about today. So I do not have the background data of each of those cases or am able to answer your question about today's cases.
20 to 30 just
I'm sorry, say it again.
20s. I mean,
Go ahead, Dr. ZK.
but what we know, again, just like you said, it came in this morning, so we don't have all the data, but we've been following the trends, and for the last weeks, more than 6 weeks, the 20 to 29, we call it the 20-somethings, have been the largest percentage of the cases. That has continued to be what's driving the cases. Yeah.
Bill Jones from ABC.
Yes, sir, Will.
What would you say to the Illinois Restaurant Association, who is considering today whether or not to file a lawsuit against the state?
I think if you listen to Dr. Landon, if you look at the literally more than a dozen international and national studies that have been done, look at the article. We've provided this to, I think, all of the members of the media, the dozens and dozens and dozens of articles about the outbreaks. Dr. Landon mentioned a few. That you'll understand that bars and restaurants are spreading locations. And we need to clamp down because we need to bring the numbers down. They're headed in the wrong direction, and unfortunately bars and restaurants are a location, no fault of the people who own them or operate them or even people who visit them. But it is true that those are places where there's a higher transmission likelihood than there is in other locations.
There's a large restaurant group meeting right now, deciding what to do with the city restaurant owners and the suburbs.
Sure.
Were you expecting such a big pushback from restaurant owners and mayors, like the mayor of Orland Park and other mayors that just decided that, we're going to do do things our way?
No, I think when you have, a president in the White House who basically has ignored this, doesn't wear masks, doesn't think that they should take this very seriously, he sends a message. People listen to, I turn on the TV and see the President of the United States. People listen to what he says. I mean, I have learned to discount it. But many people still think that he's telling the truth when he says we've rounded the corner. Do you think 6,363 people getting it reported today, or the literally dozens and dozens of people who died today? Do you think we rounded the corner? I don't think so.
With the election just days away, how would a Vice President Joe Biden change your job if he is elected on Tuesday?
Well, refer first to what I just said, which is I think a president that is modeling good behavior, someone who understands how serious this virus really is, and who has a plan to help states and local governments and people across the country to deal with the virus and to deal with the financial pain. I think all of that will be an enormous step forward. So I'm very much hopeful that that will happen. I also will say that we need to defeat the virus if we are going to ultimately restore the economy the way that it ought to be restored.
Mayor Lightfoot yesterday said that, I asked her yesterday about what they're planning to do in lieu of the election being on Tuesday from a safety perspective, if there is any civil unrest. Has she asked you, or do you have I know you always have the Illinois National Guard on standby, but is there a plan for you to work together?
Yes, and not just with the mayor of Chicago, as you can imagine. It's a big state, but of course I've talked to the mayor. More importantly, our public safety officials talk on a regular basis. They've held tabletop exercises. There's a lot of preparation, as I think you heard yesterday from the director of the Illinois State Police. Our National Guard, our emergency management agency at the state level with the state police, again, have worked with local officials to make sure that we're ready for, I hope, anything that will occur on Election Day or in the days after.
We'll do one more in the room and then go online.
Illinois,
Well,
the Illinois High School Association is going to defy your order and allow basketball. What is your reaction and what is your fear if they go forward with that?
Well, as I said this morning, I think that we had doctors and experts look at what sports we could allow, at what level of risk these sports are, to make sure that we're allowing kids. We want kids to be able to train, to perform their skills, to condition themselves for the sport, even at the most high-risk level sports. We want them to be able to at least do that, right? It's not that we're trying to shut down their sport or tell them to go home and don't do anything. But there are medium-level risks and low-level risks, and those are areas where, in fact, those sports will be played in the fall here, in the winter. But some of these sports, we're not shutting them down. We've asked that they be moved to the spring, some later in the spring. What we're trying to do is get to a point where positivity levels are much lower, where the number of cases in our state is much lower, and where I hope and pray we will have much better treatments and vaccines available. So again, it's the high-risk sports where we've asked that there be limitations just for the time being. And again, the fact that the IHSA has a different opinion, I mean, I've known that for some time about different areas of sports. We have talked to them on a frequent basis, gotten their opinions about each one of these things. And I think most importantly, I think it's going to be incumbent upon the schools to make decisions for themselves, and that's what we've left schools to do, to make decisions about how to keep the children, the kids who go to school there, the people who work there, safe. And we're trying most of all to get kids back in school. We have 1.8 million children who are not in school every day in this state. We want to get kids back in school, and sports is a secondary question, but we want to make sure they're learning, first of all, and so we want to lower the risk that we, in every way that we can, and we're going to continue to work on that. I finally will say that schools, I think, as I've said several times, will potentially be subject to some legal liability if something happens as a result of their playing a sport that, that we've issued guidance about that is, not congruous with what the school is operating under.
And this will be Mike Lowe at WGN.
Oh,
Mike
yeah.
Lowe at WGN has a question.
Sure.
University of Chicago scientist Sari Kobe has questioned if the positivity rate metric is the most useful and accurate one to guide public health decisions on restrictions. Could you explain why you rely on that metric?
Yeah, sure. If you wouldn't mind, I mean, I'll at least begin by saying, remember that just looking at the number of cases, for example, doesn't really tell you anything. There are states around the country that aren't testing. So guess what? They don't show any cases, or very few. And you can't make a judgment about how widespread the transmission is occurring, whether there's truly mass community spread, unless you're looking at positivity rates. So that's an important thing about why we rely upon test positivity and that's what we use absolutely for decisions about mitigations. We also use hospitalizations. As you know, we pair up hospitalizations with positivity on an upward trend, and that too is a trigger for certain regions have triggered that. I think Cook County, suburban Cook County triggered that recently. But I'd like to turn it over, if I may, to Dr. Landon, who may have other things to respond to.
Yeah, I read that article too, and Sarah Kobe and I are friends. We've worked together on other work before it, and I think she really is a world-class epidemiologist and computational biologist about respiratory viral illnesses. But in a pandemic, no one has the monopoly on expertise. You have to work with modelers. You have to have people like me who are experts in transmission and sort of infection control. You need to have public health officials. You have to have sociologists. You have to have economists. You have to have virologists. You have to have lab skills people. You have to have every specialist, and somebody has to make the decisions. There's no one person that gets to make all of the decisions, and like I said in the talk, there's no one metric. I think it would be a mistake to characterize her comments in that piece as being that she just thinks that that's the one metric everybody's using, because I think we see that there's a lot of data, a lot of metric.
That as part of your overall.
It's not my decision. I'm just one piece. I'm just one voice. The governor gets to make the decisions. He's our elected official, and he gets to find a way to balance all of those different experts that are speaking in his ears. And there are lots of, all of us have different things that we care a lot about, and I believe a lot in the things that I say and the things that I recommend. And Sarah and everybody else who has your ear and everybody's ear cares a lot about the things that they're recommending. But there's no one right way to do it. We have to make choices and trade-offs, and that's why you get elected.
But I will say, if I may, to your question, that the positivity rate plays a very important role. I mean, there are a bunch of metrics. We showed you a number of them here. What we want to do is try to look at the metrics at the front end, not just cases, but case positivity and test positivity. We want to make sure that we're measuring not just the number of people who are getting the virus, but how fast is it moving? And that's why we look at all of these measurements. To say that we're only looking at one measurement isn't exactly correct. The other thing is we make a lot of public policy decisions, as you know, around whether we are going to distribute PPE to certain places, how we manage certain locations, how we, whether we think that a temperature check is as good as some other method of keeping workers, let's say, out of a place where they might cause transmission, and measuring whether they might be sick or not. So we use a lot of things to make public policy decisions, and positivity is certainly one of them.
Rich Miller at Capital Facts.
Yeah.
Representative Mike Murphy said today that Springfield outbreaks can only be traced to universities and social gatherings, but not to restaurants and bars. Is that true? And if so, why close indoor bars and restaurants?
Well, I can't speak to Springfield specifically's outbreak data, or certainly the local public health department has that data, and as you know, we are providing that data on the Illinois Department of Public Health website over the next few days.
Dave Dahl, the latest GOP talking point seems to be a lack of evidence or your lack of transparency that this has anything to do with restaurants. What if I go to a restaurant and then go to Target? Who can say that the restaurant is a COVID incubator?
Well, that's exactly what I've said for the last several days. I'm sorry that Dave is not watching our press conferences every day. I have said and been very clear, sorry, I'll take my mask off to hopefully be clearer, you can hear me better, that we don't, it is often extremely difficult to know exactly where somebody caught COVID-19. I mean, that is just, it's a very difficult thing to know. What we do in contact tracing is we find out where a person has been, a case has been. We try to gather all of those locations and the people that they can identify that they may have been in front of, and for what period of time and so on, and then measure the risk and then get a hold of those people, contact them in order to make sure that they are isolating. So we can't tell 100% where somebody caught COVID-19. What we can tell is if you have multiple cases that were in a certain place at a certain time, multiple people who are positive in a certain place at a certain time, that you get you can see an outbreak, or you can call it an outbreak because there are multiple people that are in that location at the same time. So it's different, saying that someone was at a location than it is to say that that's an outbreak location. What's important is putting aside the contact tracing data about bars and restaurants, just put it aside for a moment, and even if there was no contact tracing data available at all, what we know is that from the data that Dr. Landon cited, and from all that we've provided to everybody in the media, I hope Dave has all of this, that in study after study after study, unmasked activity where people are drinking, sitting for an hour perhaps or more, in groups, this is the kind of activity that causes spread, and that's exactly what goes on in bars and restaurants. And that's why in many, many, many states across the country, they have limited severely, sometimes significantly in other times, the capacity, sometimes even closing indoor service.
Why use 11 regions? Is that the right number? Why not go county by county? Sangamon County's positivity rate is only 7.7%.
Who asked that question?
So
I just want, I only wanted to know because I want to make sure that you're aware that early on that we had 4 regions for the state. Early on, actually, to be clear, at the very beginning of this, there was 1 region, and that was the entire state. And then we moved to 4 regions because we were looking at hospitals and trying to make sure that hospitals would be available, hospital beds in every region. And if we measured that hospitals were getting overfilled in those regions, that would be something we'd want to jump on and deal with as early as possible. Now we moved to 11 regions after 4 because we were able to get more data. We felt like we could manage 11 regions reasonably well. And look, people have asked for every which way to measure, to draw the lines for regions. Some people have wanted us to do it by city, by town, by county, even by area of a city, thinking that one area might have a high positivity rate and another area a low positivity rate, and they don't want to get punished by being paired with them. Guess what? People move around. We have a very mobile society. People get out of their cars or they walk and they go to places. Sometimes you're crossing lines, a city line, a county line. You might work in one place and live in another.
Jerry Nowicki is asking, with nearly all of the regions approaching mitigations, how quickly will big money run out, and what more can the state offer in way of relief? Are you considering allowing delayed sales tax payments or allowing payment plans without any penalty for a late payment?
So thank you for the question. In fact, there were a group of legislators who wrote a letter to me over the last 24 hours, I think, that had a number of those things in it, and we've responded to them. I'll just say that we have several $100 million. We actually more than $600 million in total for different kinds of grants to community organizations and businesses. We have $220 million specifically right now in BIG grants, business interruption grants, that are available to businesses. I hope that they will go to our website, tceo.illinois.gov, and click on where it says business interruption grants, and they can apply for it. We've expedited the fulfillment of those grants so that businesses that are affected by resurgence mitigations can at least get paid in relatively short order.
Kelsey Landis at the Belleville News Democrat. Some Metro East restaurants that have been awarded big grants are still operating in defiance of indoor dining restrictions. Would the state revoke those grants for those who don't comply with the restrictions?
Yes, the state has the ability to do that if they're not fulfilling their obligation under the grant agreement, and so they could, in fact, have their grant removed. We want people to follow the rules, and, we're going to use enforcement mechanisms, as we've talked about, wherever we need to.
Hannah Mizell has a question for Dr. Zike. Are the patient's IDPH counts as COVID hospitalizations always first confirmed with a COVID test, or are some of them just presumed COVID positive because they have COVID-like symptoms? Are all patients hospitalized eventually confirmed with a test?
Right, that's a great question. So initially, I think when people come into the hospital, it's suspected as COVID. So you could be awaiting the test, and so as the test results will come in, the people who were not COVID, they would come off the list, and then we'll go forward like that. So yeah, it will include people that are suspected to have it, as well as those that are confirmed, and then anybody who's turned out to not have it, that would come off the list, obviously.
But you're walking in with symptoms. I mean, to be clear, it's not just anybody walking into an emergency room. It's, someone walking in with symptoms. I just don't want it to be taken out of context, as sometimes happens.
Jamie Monks at the Tribune, you said you're confident in the 11-region plan, but at what point would you take further action on regions or even statewide? With 9 regions now under mitigations, are current Tier 1 and Tier 2 restrictions enough to curb the spread of the virus?
I don't know. I mean, I really would like to know the answer to that. This virus is unknowable, seemingly, at least so far. There's an awful lot of research that's being done, and we've learned a lot. But the fact is, if the question is, is it enough? Is this enough? I don't know. We didn't know when we put the stay-at-home order in back in March. We didn't know if that was enough. We didn't know if the Tier 1 mitigations that we put in for Region 4 and Region 7 would 100% work. We had a pretty good idea because we thought these are spreading locations. If we close down indoor service, guess what? It worked. And so we have this regional plan because it does work. We're hoping it'll continue to work. But I have to say one other thing, which is, it's not like we have every answer to every question, but I had hoped that maybe Illinois, doing as well as we had been doing, perhaps that we wouldn't see a second wave or a new wave of coronavirus. Boy, was I wrong. And by the way, this is now happening all across the country. We're in the midst of a neighborhood where people have positivity rates, case rates that are soaring, hospitalizations. There's a field hospital that's been put together in Wisconsin because all the hospitals are full. We're taking it as it comes. We're putting in mitigations that we've learned work, and we'll continue to move in that direction from Tier 1 to Tier 2 if we have to.
Kelly from Block Club. Chicago's mayor and top health officials say the majority of new cases in the city are coming from small gatherings. What is the state doing to stop or prevent those gatherings, and do you worry closing restaurants will lead to more people gathering at home instead?
Well, first thing we're doing is every day standing up here and reminding people that these kinds of gatherings are spreading events. You heard Dr. Landon talk about this. You heard Dr. Zike talk about it. You've heard me talk about it. We'll continue to try to get that message out. We have reminded people over and over again that if you're going to have people in your house that aren't part of your pod, you should still wear a mask and keep socially distant. You shouldn't do it for a lengthy period of time. We're doing everything we can to kind of prevent the spread in private locations. Obviously, there's very little we can do when people are engaging in that. We're not going to knock on the door and, take people away or something like that. That's never going to happen. We are asking people to take personal responsibility for themselves, for their families, for their neighbors, for the friends that they invite over. Be careful. We want you to be safe, and we want you to keep everybody else safe.
Jake Griffin at the Daily Herald. Where is the state at in opening testing sites using U of I saliva-based tests, and how did the FDA ruling affect the rollout?
Yeah. So first of all, the fact that we have the ability to use these saliva tests is because the FDA gave us permission to do that. There's a CLIA-certified lab at the University of Illinois that's been doing this since the very beginning. Those tests are very effective, and you can see by the data that comes out of the University of Illinois, Urbana-Champaign, that they are doing a terrific job of keeping their positivity rate. I mean, I think it's certainly below 1%. Maybe 0.5% or lower than that. In terms of spreading it to other locations, that is the saliva test. They are working with other hospitals and other laboratories to make sure that they have to be CLIA certified and that they have the right equipment. And so they're working with, for example, hospitals in the Bloomington-Normal area and labs, I should say, in the Bloomington-Normal area to help the Illinois State University in this regard. And you know, obviously they've been consulting with universities and colleges all across the state of Illinois so we can get it spread to every location, sorry to use the word spread, to get those tests used in every location that we possibly can. Again, I'm you know, 100% behind that effort, and the doctors and the experts that are working on that are every day on it. There is literally what I would describe as a small company that's been put together at the university that is doing that work.
Rich Miller has a follow-up. Dr. Z-Day, he says that this lawmaker who was talking about the lack of bars and restaurants contact tracing in Region 3 specifically said that you said it can only be traced to university parties and gatherings. Can you just clarify what you're seeing in the exposure data in Region 3?
So there's exposure data and then there's outbreak data. Those are two different pieces of data that are collected. Again, as the governor explained, the outbreak data will be where all of these individuals in the same space and time were diagnosed as cases, and they're connected to one another. Clearly, there's a connection. Like, I was with you and I developed symptoms. We were in this space and these people were all connected. So that could be, you know, at a fraternity party, that could be at a weddings. Those were clearly identified outbreaks. Most people who end up contracting the infection don't know exactly who they got it from. They don't say, oh, I was with so-and-so who was positive, that's where I got it. If they don't have any idea of who they got it from, then that's when you go into the contact tracing in terms of identifying places that they were in the time that you would have contracted the virus. And so from that data that you collect, you know, from all these people who are just like, well, I was here, I was there, it is consistent that where those people recollect that they were in the time were bars and restaurants. Obviously, they will, you know, people who are in school, they will say school. People who are at work will say work. So, you know, we already told you we're not the ones who are going to be closing school. We're not going to tell people not to go to work. We have to operate in the place that we can operate, and there you have sitting there bars and restaurants coming up time after time in the exposure sites that people were in there before they contracted the virus.
That's not specific to students, if that was the question. It could be anybody that goes to bars and restaurants. Yeah.
Mike Milicic will be our last question. With the entire state on the verge of increased mitigations, how can you convince business owners to follow the guidance when attorneys travel around the state telling them to stay open and defend their rights? How can Illinois truly stop this trend?
Well, we can't stop attorneys from, you know, being snake oil salesmen and trying to convince people to take them on as an attorney. And you know, these folks are been in business for time immemorial, and I guess they'll keep doing what they do. The reality is that we're going to beat them in court. I mean, we already have, and they're just wrong. They're citing, you know, statutes that either don't exist or they misunderstand the statutes. And so, you know, I just be clear that you know, we are following the laws of the state of Illinois, and most importantly, we're following the emergency management you know, data and the Department of Public Health data in order to come to the conclusions that we reach.
All right, thank you, everyone.
Thank you.